So we're still talking about structure and balance. So we've come to a point where just before in the last video I was talking about hormones. I'm going to continue talking about hormones and a little bit of an example. In core therapy, I mentioned before that we test the cranial bones. So we ask someone to touch different bones and they'll get a neurologic reaction to that touch, which will allow us to see there's actually an imbalance. And we have a treatment system along with the chiropractors and the osteopaths and the craniosacral people that we believe that this system is all moving here and it's having an effect on the brain, neurologic function, movement of fluid, cerebral spinal fluid, and actually glands and hormones and how the whole body's working and how it all integrates together. So something I want you to look at, I've got this little guy here that I'm going to pull apart so you can have a look at a bone. All of these bones have a structure, they all have a shape, and the shape does a function or many functions within the system. So I can just take that off without pulling it apart. Look at this beautiful bone here. It's called the sphenoid bone and it's absolutely fantastic. Looks like a big moth. It's got the wings. The interesting fact is that here's what we call the sphenobacillus in chondrosis. It's the joint between the occipital bone at the back of your head and the sphenoid bone. And what looks to be a working system that affects us quite badly is where the position of this bone is. If this bone is out of alignment, then often we can get dramatic, serious lower back problems. Once it's back in place, immediately all the ligaments bind and give us balance back again so we can stand up strong. So what tends to happen is if you go somewhere with a bad back, they'll look at your back because they won't know about the whole system from top of the head to the feet. So they're not working with the system, and this bone here, the balance of this bone, will dramatically affect how you're holding yourself together around the belt area or the girdle area. If this joint is compromised, just above it is the pituitary gland. That's one of the main controlling factors of your whole hormonal system. So if your hormones are out, whether it's a cyclic problem or whether it's a constant bad problem, then actually often we can find that these bones are slightly imbalanced and slightly misaligned. You can see it a lot clearer when it's actually taken out of place here. So this little chap's very important. How it balances itself or how it's imbalanced. Not only does it support the hormonal system, but also it holds frontal lobes of the brain, and there's a lot of decision making and a lot of conscious thought going on there. So a slight misalignment of the bones in the cranial system can have a dramatic effect all the way through your system, all the way right the way into your reproductive system, how the muscles fire, how the ligaments bind, how strong you are, how committed you are, how you feel in the morning, how you feel in the evening. So it's very important that we have a look at this system and we make sure that this system is balanced, whether it's pain or hormone imbalance. It all comes down to balance at the end of the day.